Hello, my name is Chris. Today we're going to talk about the major depressive disorder. Of course, depression has to do with a mental disorder, but when it has lasted up to 2 years and the individual, the patient cannot function very well, we term it a major depressive disorder. So if we talk about the causes of major before we talk about the causes, let's talk about the risk factors. We'll have some risk factors that are associated with major depressive disorder. We'll talk about obesity, some sickness, obesity, heart disease, maybe some people that have cancer might contribute. These are risk factors that has to do with depression. So when we talk about the causes of depression, major depressive order, we have the biological causes and the psychological, social causes. So when we talk about the biological, we'll talk about abnormalities in the dopamine, serotonin, and norepinephrine. When we talk about the psychological and social, we'll talk about our abnormalities in our everyday life, like being broke, like your financial status, when someone cannot pay his rent or is evicted, homeless, or maybe someone has having a problem in the marriage is tending, maybe file a divorce. These are things that usually causes a major depressive disorder. So now we're going to talk about the treatment. So treating a major depressive disorder can be done in two ways. We can do the pharmacological way of treatment and the psychotherapeutic way. So if you talk about the pharmacological, we have the SSRI, the SSRNI, the tricycline, antidepressants, and the MAOI. So the SSRI, which are the first line, the selective serotonin reuptake inhibitor, it's the one of the first treatments that are given and a choice medication, though it has some anticholinergic effect and some effects like low libido is still preferred because it has a better choice than the tricycline antidepressant and the MAOR. Also, if we talk about the psychotherapeutic, you talk about the different therapies, that we use for uh, um, for treatment, the cognitive therapy and other therapy which we put the patient on. Yes. So now we're gonna talk about the patient teaching. So when we talk about the patient teaching, we'll have to focus on the symptoms of the major depressive disorder, and making sure that the patient is on the meds and on the therapy. So it's going to be a patient oriented. We're going to focus on making sure that the patients receive all the help he can, and making sure that the patients is also safe. Make sure that the environment where the patients are is safe, because these patients are, if exposed, can harm themselves. Also, we also talk about making sure that the patient at every point in time, if possible, has someone to make sure that is around him. Also, and we're going to talk about the nursing intervention. So when we talk about the nursing intervention, we have to talk about the safety. We talk about the self-harm, making sure the patient does not harm themselves, the patient is safe, making especially the suicidal thoughts. Some of the patients that has a major depressive disorder tends to have this suicidal thought. We want to make sure we are there, watch it. Is going to be one of the main focus, and also an environmental